Hi, this is Dr. Brian McDonough, and it's my pleasure to have with me Dr. Valerie Arkoosh. She is the Pennsylvania Secretary of the Department of Human Services. She brings a wealth of experiences as a physician and a public health professional. And honestly, you have somebody in this role who clearly understands about care and the importance of it. I want to pick it up there, Dr. Arkoosh. I wanted to ask you about PA Navigate and its role, and in particular, how it really helps those who need care the most.
Well, Brian, I'm so glad that you're asking about this. And I know that you'll understand what I'm going to say next as a fellow physician. So many times when a doctor is talking with a patient, they know that there are some real unmet needs outside of the exam room. Maybe that person has unstable housing, or maybe they have a really hard time accessing healthy food in their neighborhood. Or maybe there's a behavioral health issue or some other issue that they could really use some help on for somebody in their family. And PA Navigate is going to be, when fully implemented, a connector between an individual Pennsylvanian, their healthcare providers, community-based resources, our state and our county governments, which help to provide so many of those resources. So just as a very simple example, as a physician or nurse practitioner, if you're seeing a patient and let's say they have newly diagnosed diabetes, and you would like to make sure that they have access to fresh, healthy fruits and vegetables, but they tell you it's really hard for them to get that in their neighborhood. You'll be able to go onto a screen in your electronic medical record, and just like you would prescribe insulin for their diabetes, on that next screen, you can prescribe a consult with a community-based organization that can help connect them to a food source, a healthy food source in their neighborhood or near their neighborhood. That's something that we just can't do right now. And I'm so excited. This was a tool I wish I'd had as a doctor, that I wish I'd had as a county commissioner. And it doesn't take a healthcare provider. Any Pennsylvanian can go online to PA-navigate.com and do a self-referral for any of those types of things.
You know, it's interesting you bring that up. I teach in a residency program, and residents come in and they're always scrambling because one of the hardest things to do is to get that extra care for our patients. If you're in a safety net hospital and a program like that, you really have that struggle. And let's face it, working on computers has been a trial as we've learned and grown with them as physicians. Everybody will tell you that, but this is one of those rewards, the fact that we're going to get something where we can make that connection. And I did want to ask you about the value of that. You know, we have health information exchanges like HSX, and they're obviously valued and they're very important. Tell me about the role of them and how we can use those tools to try to improve access to care like this.
Well, they're really very, very important. They're kind of the background network that is making this all happen. So currently in the Commonwealth, we have 5 health information exchanges. The one that is predominant in the Southeast is HSX, and they are all working together with PA Navigate, the Department of Human Services that I lead, use some ARPA funds to help get this initial system set up, and they're all part of it. And so they become that sort of back-end network that will allow all of these connections to happen no matter where you are in the Commonwealth. So that's what's extremely important. I think some of us have had that experience of being able to go from one part of the state to another, and maybe you're on vacation and you walk into an urgent care center in another part of the state, and they have your medical records. It feels like magic, right? So that is what these health information exchanges are about. And now we'll be able to add to that all these other services like housing and access to food and other services that maybe you don't think of getting exactly from your doctor, right? But now your doctor will be able to help you access them more easily.
Again, this is more your area than mine, but I'm trying to learn. There's something called a 1115 waiver, which is allowing opportunities to grow and these health information exchanges to continue what they're doing. Can you explain that, what that is and how that helps PA navigate?
Now that PA Navigate exists, it really sets Pennsylvania up to be a leader in taking advantage of connecting Pennsylvanians with what are called social services that fit into that category of something called social determinants of health. So what does that mean? Well, we all know that there's many factors that go into making us healthy, and being able to see a doctor and get good medical care is absolutely a piece of it. But we know now that perhaps even more important in aggregate is making sure that you do have stable housing and healthy food and a place to exercise and a neighborhood that's safe to live in. All these other factors called social determinants of health. The 1115 waiver is kind of a wonky name for an opportunity under the Social Security Act that allows us to use Medicaid funds for purposes beyond simply traditional medical care, physical and mental health medical care. It is an opportunity that the Biden-Harris administration has made available to us to use these dollars for the social determinants of health. So the Pennsylvania, our Department of Human Services has applied for a 1115 waiver. If the federal government approves it, and very important, if our General Assembly appropriates the state dollars that are necessary to implement it, we will be able to bring in new federal dollars, substantial federal dollars into the state that will give us some new tools in our toolbox. And we're asking for four things. Very importantly, we're asking for continuous eligibility of children from birth until their 6th birthday, if they qualify for Medicaid, to stay in that Medicaid program. We know that early interventions with children are absolutely essential to their long-term success in school and in the workplace. And interruption in those services can really be detrimental. I'm talking about speech therapy, physical therapy, occupational therapy, behavioral health services. So we want to make sure there's no interruption in those services for children from birth until age 6. We're also asking to use some of those dollars for food as medicine programs, kind of what we've just been talking about. If you have newly diagnosed diabetes and you need to understand how to really, radically change your diet, then we'll be able to help you for a short period of time to do that. A third element is around housing. Housing is just essential. Imagine if you just got diagnosed with diabetes and you are sadly living in your car and you need to put your insulin in a refrigerator and you don't have a refrigerator to put it in. What happens next is those individuals end up back in our emergency rooms. They lead to some of the overcrowding in our emergency rooms, and also it's unnecessary dollars being spent. All of that could be avoided if a person had a stable place to live. And then finally, for individuals that are reentering their communities after a period of incarceration, so these are individuals that have paid their debt to society and they're now returning, our goal is to help set those folks up to be successful when they return and not recidivate, not end up back in a correctional facility here in the Commonwealth. And so part of what we're doing is asking for a set of services that would help with those transitions. So it's a pretty exciting opportunity. And by having this PA Navigate platform now up and running, it really makes it so much easier for us to help build those connections between individuals and those services in their communities that are going to set them up for success.
It sounds like a big task ahead to get the funding, but at the same time, you're hitting a lot of the target points that as a provider I really care about and I think would be really important. And now, is PA Navigate a part of that funding? Will that also be given to the Health Information Exchanges to assist, or how's that work?
PA Navigate is totally separate. So PA Navigate is being implemented right now across the Commonwealth, and that will continue regardless if we get this additional funding. But because we already have PA Navigate up and running, and we are way ahead of other states on this type of interconnectivity across the Commonwealth, it'll just make it so much easier for us to use that platform to help connect individuals to these services. What the waiver funds will give us is a better ability to pay for those services.
Okay, so what we're really waiting for in a lot of ways is the services to be approved, the financing for that, so then PA Navigate can kind of kick in and start doing those things, connecting people to even enhanced services.
Yeah, it'll be a big help. The PA Navigate's already there.
Okay. Now I know in some cases now we're trying to have more of a national health information exchange as well, and that's beginning. And you mentioned that Pennsylvania is way ahead of other states. How does it look towards coordinating with neighboring states to cover patients and to improve their care? Where are we with that?
Making some progress. There are some interstate compacts where a few states have agreed to share information. So again, I talked about being on vacation in Pennsylvania, but we know a lot of Philadelphians in particular go to the shore during the summer, right? So it would be great if you walked into an urgent center down the shore and they had all of your health information. So that would be the ideal future. And we're slowly but surely making our way there.
One of the things as well is I know these health information exchanges like HSS can help. What other ways can they help you to achieve these goals that you're trying to put through? Like, what are we not thinking of that they could be used for down the road?
I think it's really exciting what we're starting to see. I just recently learned about a program that HSX is doing with the Independence Blue Cross Foundation in the Philadelphia region. And they are setting up a program that will help send alerts to older adults that have pre-diabetes. And it's, alerts about getting out and taking a walk or making sure you're eating healthy food. I'm not exactly sure of the specifics, but it's really exciting to me to see that now that PA Navigate exists and these exchanges are becoming more interconnected, that the exchanges are working with funders in the community, like the IBX Foundation, to create programs to serve older adults in this case, but I'm sure there'll be many other programs in the future to help meet unmet needs for those individuals, all with the goal of helping them stay healthy. So I think this is just the first of many of these types of things that we're going to see come up. Some will probably be more successful than others, but that's the exciting part about this, that we now have this technology and this platform that will allow really innovative thinking and trials that, seeing what actually works, what doesn't feel too intrusive for the person individually, but actually helps them stay just a little bit healthier, keep them out of that emergency room, keep them out of that hospital where, of course, none of us want to be.
A lot of doctors, when they're seeing patients, I've had them say to me, like, why should I ask about somebody's housing situation or ask if I can't do anything about it? It seems to me PA Navigate and tools like this could really help encourage doctors to ask those questions, because now it seems like you can at least get people in a proper direction. In other words, we always, let's face it, as physicians, we ask things we can control or do something about. So we'll give a medicine or medical advice. But as far as housing and finance and all those social things, those social determinants, it's often tough. Do you think it's going to help encourage and maybe revolutionize the way doctors provide care?
Brian, I think this is going to be a game changer when it's fully implemented. We both know that you might want to ask those questions, but if you ask a patient about their housing situation and they tell you that they are sleeping in their car or sleeping on a relative's couch, but they're about to be kicked out, as a typical way that our practices are set up right now, the doctor does not have an easy way to respond to that piece of information. And knowing how tightly scheduled physicians are and what their days look like, honestly, sometimes it's just easier not to ask the question in the first place. And this is the problem that we're trying to solve for. We want it to be just as easy for a doctor to ask that question, to ask about food, to ask about, do you have a place where you can safely exercise in your neighborhood, right? All these things that we know are critical to being healthy. We want it to be just as easy to ask about and then do something about those things as it is to adjust a patient's blood pressure medicine. And that's That's the vision of PA Navigate, and I'm so excited to tell you we're on our way there. We've got a couple hospitals that are starting to incorporate it into their electronic medical records. And once that is fully implemented across the state, it'll just become part of the routine medical visit, I hope.
I've asked a lot of questions, but one of my favorite questions and most important is not to limit you and to say your vision and how you see the future and some of the things you're trying to achieve as well, and how this will help people in their care.
You know, I really am so honored to have the opportunity to lead the Department of Human Services. And I come to this work from having practiced medicine for 20 years in Philadelphia, taking care of a lot of pregnant people and their families during labor and delivery, and really seeing firsthand the impact of what happens when someone doesn't have access to good, stable services outside of the hospital. You know, it doesn't matter how great your care is in the hospital, is if the minute you walk out that door, you don't have enough food to eat. And so I have an opportunity now with my team here and with our governor to build bridges to success. And that is part of what we do every day here at the Department of Human Services. We are all about creating those bridges so that just sometimes very simple things like making sure somebody with diabetes can eat healthy food, that keeps them out of the emergency room. It keeps them out of the hospital. And more importantly, it allows them to continue to go to work and care for their families and live a long and healthy life. These things are absolutely essential. And I am really excited to have the opportunity to work on them here. Hopefully, we'll get that funding from the federal government for the 1115 waiver, and our General Assembly will work with us to approve the state funding to implement it fully. And we'll be on our way to really helping Pennsylvanians, no matter what corner of the state they live in, live their best and healthiest life possible.
One thing I did want to ask also, especially with the 1115 waiver and the technical aspects, is we're in a situation now, obviously it's an election year. President's going to be elected and a lot of major things. How does the political situation impact things like this, initiatives and things you're trying to work on? Does it change it? Does it impact who gets the opportunity to take that funding and use it, or how the funding's appropriated?
Well, changes at the federal government can certainly impact these, the ability of these 1115 waivers to be approved. And so that is something that we're keeping a close eye on. This opportunity to use federal dollars through the Medicaid program for things beyond traditional medical services is something that we've seen really come to the forefront in the current Biden-Harris administration. So we are keeping an eye on what potentially could be next. But really, Brian, everybody just wants to be healthy. Being healthy, I hope that's a bipartisan issue. I can't really think of a more important one. Nobody wants to be in the hospital. No one wants to have to go to a nursing home, right? No one wants to go to the emergency room. And the types of bridges that we're building, that idea of bridges to success, are really simple things, very cost-effective things that keep everybody healthy. And I hope that's something that we can all agree on.
I'm Dr. Brian McDonough, and I've been speaking with Dr. Valerie Arkoosh, who is the Secretary of the Department of Human Services in Pennsylvania. Anything else that you wanted to bring up before we conclude that you thought was important as a final point?
I just want to remind folks that if you want to check out PA Navigate and see what services are available, you can go to pa-navigate.com.
Secretary Arkoosh, thank you so much for taking the time to join me today. I really appreciate it.
Thanks, Brian. It was a pleasure.